Moving on to applied physiology, let's first see about hyperthyroidism. In this condition, there is increase in secretion of thyroid hormones. It can be caused by Graves' disease and thyroid adenoma. What is Graves' disease? It is an autoimmune disease. We can find antibodies called thyroid stimulating immunoglobulins. So these thyroid stimulating immunoglobulins bind to thyroid stimulating hormone receptors on the thyroid cells. So when they bind to the receptors, they stimulate the thyroid gland to overproduce the hormone and release the hormone. And this results in hyperthyroidism. One of the clinical features seen in hyperthyroidism is exophthalmos. It is a condition in which there is protrusion of the eyeballs. It is caused by edematous swelling of the retroorbital tissues and degenerative changes in the extraocular muscles. Some of the clinical features seen in hyperthyroidism are the following. Now let's start from head to toe. It will be easier to remember that way. As I said just now, there will be exophthalmos, and because of the stretching of the extraocular muscles, there will be ophthalmoplegia. There will be goiter, that is enlargement of the thyroid gland because it is overproducing and overworking, and cardiac effects can be tachycardia, atrial fibrillation. There can be diarrhea because of increased intestinal motility, and in females there will be decreased menstrual flow, that is oligomenorrhea, or sometimes absence of menstrual flow, that is amenorrhea. There will be excessive sweating and heat intolerance because of increased BMR, and because of increased BMR there will be weight loss despite having an increased appetite, and they can have fine tremors in the hand, and their deep tendon reflexes can be exaggerated. Now that we have seen about hyperthyroidism, let's see about hypothyroidism. So in hypothyroidism, there will be decreased secretion of thyroid hormones. If this happens in adults, it will cause what is called myxedema, and if this happens in children, it will result in a condition called cretinism. The common cause of myxedema is an autoimmune disease called Hashimoto's thyroiditis. There will be non-pitting edema, which results from infiltration of the skin with glycosaminoglycans along with water retention. Cretinism is caused by extreme hypothyroidism during fetal life, infancy, or childhood. This will result in failure of body growth, and there will be mental retardation. So cretinism can be seen in babies who are born to hypothyroid mothers. There can also be a congenital lack of thyroid gland. In this case, it is called congenital cretinism. Or this can happen due to iodine deficiency in the diet. In that case, it is called endemic cretinism. Some clinical features of hypothyroidism are mental impairment, depression, lethargy. They can have intolerance to cold because of low basal metabolic rate. They can have goiter, that is enlargement of the thyroid gland. And in the heart, they can have decreased pulse rate, that is bradycardia. Then they can have anorexia, that is loss of appetite. But irrespective of having anorexia, they will still have weight gain because of edema. They can have constipation because of decreased gastrointestinal motility, and in females they can have menorrhagia. They will have dry skin, body ache, and generalized weakness. Some of the parameters in thyroid function test which help us to diagnose hyper and hypothyroidism are free thyroxine, basal metabolic rate, thyroid stimulating hormone, and thyroid stimulating immunoglobulins. In hyperthyroidism, free thyroxine level is increased, whereas it's decreased in hypothyroidism. Basal metabolic rate is plus 30 to plus 60 in hyper, whereas it is minus 30 to minus 50 in hypothyroidism. TSH levels will be decreased in hyperthyroidism due to negative feedback mechanism and increased in hypothyroidism. TSI level will be high in hyperthyroidism in cases of thyrotoxicosis and low in thyroid adenoma. Let's see the differences between hyperthyroidism and hypothyroidism. Hyperthyroidism can be caused by Graves' disease or thyroid neoplasm. Hypothyroidism can be caused by thyroiditis, surgical removal of thyroid gland, cretinism, or decrease in thyrotropin releasing hormone or thyroid stimulating hormone. The TSH level will be decreased in case of hyperthyroidism, whereas in hypothyroidism it can increase or decrease. So because of decreased feedback inhibition, it can increase. Or if the primary defect is in hypothalamus or anterior pituitary, the level of TSH will decrease. Treatment of hyperthyroidism is by propylthiouracil, which inhibits the thyroid hormone synthesis by blocking the peroxidase enzyme, thyroidectomy, and beta blocker, which is used as an adjunct therapy in the treatment of hyperthyroidism. In hypothyroidism, the treatment is usually by thyroid hormone replacement. Apart from T3 and T4, thyroid gland also secretes calcitonin. It is a peptide hormone secreted by the parafollicular cells or C cells. It plays a main role in lowering the blood calcium levels. It inhibits the osteoclastic activity and stimulates the osteoblastic activity. The regulation of this hormone is by negative feedback mechanism. So that's all about the hormones secreted by the thyroid gland. Thank you and have a nice day.